Welcome to Local to Global. My name is Jason Steffenhagen. I'm the Associate Minister at The Well, a United Methodist Church in Rosemont, Minnesota. Thank you for joining us for episode 6, as I'm joined by Tami, who you all know and love as the Communications Director at The Well. And we have another guest with us today, Lori Mazer. And Lori has been chairing the task force for COVID-19 for The Well and doing an amazing job. This past Sunday, we had a meeting after our second service called the State of the Well. And we had members from our church come share all about where we've been, where we are, and where we're going. And one of the most important updates came from Lori, who was updating us on where we're at with the pandemic and how the church is functioning. And so we wanted to sit down with Lori and just kind of dive into a little bit of what she shared yesterday at the church, and then also provide a little context for some of that. So Lori, welcome to Local to Global.
Thank you, Jason. I'm glad to be here.
So we just have a few questions. If you don't mind, can you give us maybe an update on a little of what you shared in the State of the Well, kind of like where we're at right now and kind of what the next couple of weeks will look like for in-person worship?
Sure. So I'm sure everyone has been watching the news and is well aware that things are changing rapidly as it relates to the numbers of COVID cases in the US and in Minnesota, and how things are starting to open up. So what I shared yesterday is that we as the WELL's COVID task force have also looked at the guidance from the CDC, from the governor, the Minnesota Department of Health, as well as the annual conference for Minnesota on the Methodist Church. And things are moving toward reducing capacity constraints and making some changes to our masking requirements. So I kind of shared quite a few of those things. And there's big things coming, a lot of good news, and it all hinges on people getting vaccinated.
Yeah, last week was a whirlwind. It was like day and day and day. There was more information that we had out from the CDC, and then all of a sudden the governor, and then you guys met last Saturday because you met last Tuesday, and then all of it changed. And so you had to meet again on Saturday to be like, okay, back up. What are we going to do now, right?
Right. Exactly. We had already started the train in motion to aim toward allowing singing. So that's probably the first change that's coming next Sunday, the 23rd of May. Masked singing is allowed. And I don't mean masked singer. I mean singing with your mask on. And I will just qualify that. Even if the governor says you don't have to wear a mask, even if you're fully vaccinated, when you are singing, you are projecting your voice. And there is certainly a chance that if you, unbeknownst to you, have contracted or been exposed to COVID, it is possible to transmit it. So the safest thing we can do when singing is wear masks. And we'll start that next Sunday.
Oh, that's so great. I know so many people are going to be looking forward to that, singing some of their favorite hymns, joining in some of their favorite times of worship. It'll be a really wonderful time. And so thank you for all the work that you've done to keep us safe, that allows us to get to this point where we can have vaccinated people, have the right protocols in place. And so we can start doing those things that we've enjoyed. So we've had a lot of dynamic change in the last few weeks. And so one of the things that people really love is being able to take communion. So what can you tell us about communion for the Well?
Yeah. Thanks for asking. The next big Sunday for us will be May 30th, and we're going to update some things about pre-registration and that. But on June 6th, which is our next Communion Sunday, we have definitely feel that it's safe to move communion back into the church. It still will be in the individual cups as we've had it before. But the communion can be right there during the service in worship. And the good news on that date also is fellowship and treats will be able to get started on June 6th in the fellowship hall and probably in the lobby. We want to make sure it feels safe for people. So we want to offer an option to grab a treat and head outside. But we are coming back together in fellowship starting June 6th.
That's going to be huge. I mean, like, that is one of the things I think people have missed since last March is being able to just chat with their friends after service, either chatting
Yep.
about the service, chatting about what they're doing, and just that connection. I mean, that connection has been sorely missed. And so to have the goodie treats that, are we having our friends at the well make those treats for us again?
Yes, I assume so. I know Bree from the office is lining up all the volunteers that do that. That's actually why we're not starting treats any sooner, is she needs to get back the volunteer schedules to make those treats. So yeah, they should be homemade treats as long as that's what the volunteer wants to do.
Oh yeah, that is one of the great parts is we have some amazing bakers at the well. And so I'll be lining up for those treats because I miss those treats a lot.
Yes.
Well, and
Yes.
I'll say that my connection to the well started at the beginning of the pandemic when Sherry asked me to kind of come pinch hit and do some preaching. And then she somehow roped me into applying for a job. And so I've never experienced the in-between after party fellowship treats other than the gift basket I got when I got hired, which was amazing. And so I can't wait for this experience as well. It should be really fun to see people first of all, but then also eat some goodies. That'll be really great. I should note really quickly for those of you that may be a little confused about timing. So we are recording this on Monday, May 17th. Yesterday was May 16th, and that's when we had the State of the Well. This will be released on Tuesday, May 18th with an email that will also have a lot of the information that was shared on Sunday. And so if you're listening to this at a later point in time, things may have changed. We're recording this again on Monday, May 17th. So Tami, go ahead. You had a question.
Yeah. Speaking of, you said June 6th was when we start the fellowship and the coffee and the communion and stuff like that. Does that include no masks? Because with the fellowship, no distancing, anything like that, how does that play together?
Right. So really good point. So the 23rd is the singing with your masks on, but we're really looking at May 30th as our first day in which fully vaccinated individuals can not wear a mask. And at the same time, we are also reducing some of the distancing. So we're following, again, the CDC guidelines that say, if you're fully vaccinated, masks are optional, either indoors or outdoors. And so what will happen on May 30th is we are going to take 2/3 of the sanctuary, remove the distancing requirements, the every other pew, and we will allow unvaccinated or vaccinated individuals to sit there, families, and they will be sitting much more close together. Now, we do have to remember that not everyone has been vaccinated. There are certainly children that are not vaccinated, youth that are not vaccinated. And to be very honest, there are people who can never get vaccinated because of underlying conditions. So a couple points on that. I want to make sure that we at the well are welcoming to anyone wearing a mask, or if they're fully vaccinated, not wearing a mask. So no one at the well should ever look down on anyone who chooses to wear a mask, even if they've been vaccinated. And what we're going to do is reserve 2 sections together on one side of the sanctuary. We will keep that section, those 2 sections distanced, and that the people that sit there will be wearing masks, most likely. It will be those that are not vaccinated or not comfortable yet in taking off their mask, whether they've been vaccinated or not.
That's so great. I love that provision for people. The flexibility of that is really wonderful. If you're curious if we're going to be asking you at the door to show us a vaccination card, we're not going to do that. So don't feel like we're going to be judging you or anything in that regard. Whatever you choose to do, we're going to honor that. And we're going to trust each other that when you say that you're fully vaccinated and able to sit in that section, that's really the case. And so we trust each other. We love each other. We want to be as neighborly as possible. And Lori, I really appreciate your leadership in really naming this as loving our neighbor well. You said that during the State of the Well. I had a conversation this morning with someone who told me I loved the way it was framed about, hey, if somebody needs you to wear a mask, or if you still feel like you need to wear a mask, that's okay. Like, no judgment. We want to honor one another, keep each other safe. and recognize that that's the Christ-like thing to do. So thank you for your leadership in that.
You're welcome. You're welcome. One other thing that's going away on May 30th, and that is the pre-registration. So we've been pre-registering everyone just in case there were positive cases that happened and to someone who was in the building. We've been registering and checking in and making sure that we are aware of everyone in the building, just in case contact tracing is needed. God has been great to us and our precautions have worked, and we've never had to use that contact tracing. So what we plan to do is discontinue the contact tracing on May 30th. We may have people stop and sign in because frankly, we've been also using that as an attendance vehicle. Instead of the connection cards, if you remember, we used to pass those down the line or whatever. Just because it's safer for people to indicate their attendance on their own without passing something in the pews, we decided that we may have sign-ins, but it's not going to be a stop, register, and recheck. We also will continue to have hand sanitizer all over the church because that's still good practice. It's still a good hygiene measure that keeps us not only healthy from COVID, but flu and colds and anything else.
Yeah, I think Lisa mentioned it yesterday in the meeting where she said this was not just a healthy year from keeping people safe from COVID for GDK, but it was their healthiest year they've ever had because the new air system kept your minor colds, your other types of flu away from the kids and kept people safe. And so what a great thing with that new system. And again, a credit to the committee that's really helped lead the way on getting all of those things in place for us.
Yeah, that was definitely, it was awesome to hear that Lisa said in GDK it was their healthiest year. My children went through GDK and it like September, October was like every other day. There is this in this class, here's all the information for that. There's this in this class. And I was, stressful as a mom. I was like, okay, is that our class? Do we have to worry about hand, foot, and mouth disease? And so I bet Lisa took a breath of fresh air thinking, oh, well, we have all of the new HVAC system and we have all these health and safety rules that are in, I'm knowing them anyways. The kids were in the bathrooms washing their hands before they ate, that after they came in outside. So they already had practices, in place already, but it's still, the kids, they play together. And so they eat the toys, when they get younger they get. So, but this year has been one of the healthiest years. So that's amazing. It just shows a difference and how much that the well has taken care of making sure that preschool can continue. And so that was awesome to hear yesterday too. And keeping the hand sanitizer, absolutely. I think like cold and flu season, just so I avoid it, come up this fall, I might wear a mask again when I'm out and about in a huge crowd, I don't want to get sick again. So that has taught us a lot in the past year too.
Yeah. Yep. It was a great investment. Actually, that's what they shared at the State of the Well. That improvement in air exchange that we put in place because of COVID and the purchase of all those hand sanitizer stations, those are really good investments for the future. COVID or no COVID.
Yeah, absolutely.
So Lori, let's go behind the scenes for a second. So I think a lot of people at the Well have not only been appreciative to the COVID task force, but I think they're a little curious about what goes on in those meetings. So maybe give us a couple of highlights or kind of how you guys come to the decision making that you do.
Okay, sure. Well, first of all, I just have the COVID task force is a great team. We have 4 or 5 healthcare professionals on the team, all that go to our church, love our church, plus our facilities experts, plus several from the staff. So it's been a great team. We bounce things off each other as requests have come in. Say the quilter ladies wanted to begin meeting in their small group. That came in and we developed some just by talking with each other and referencing what are the guidelines out there, the CDC guidelines, et cetera. And also what are the guidelines that our own healthcare providers that we work for, what are those guidelines? So we had a couple that work with the elderly, we had a couple that are in hospitals. And it was really helpful to kind of have all those resources to fall back on. So we looked at all the information available to us, talked about what are the risks that people are facing if they do get together. A good example is bringing treats back. You know, the risk that always has been there with fellowship time is masks are off, you're talking, you're not singing, but you're still talking and likely close to each other. That is a prime way that COVID spread. So that's why we've had a stop on the fellowship time for so long. That's why we move things outdoors, because evidence showed that outdoors, the droplets, the aerosols go away and you're able to safely talk to each other at a slightly closer distance. So that's kind of the give and take. We've had people on our team that say, well, why not? And others that are really cautious. And we have always been able to come to a good consensus that we all are comfortable with.
That's awesome.
I love the way that team functions. And I will say that with the food thing, if you're anything like me, I have a really bad habit of not wanting to waste a single crumb. And so I tend to lick my fingers too much. And in the COVID era, and in any era, let's be honest, not the best way of loving my neighbor. And so although I can't wait for treats to come back, I have to be careful with my habits, because it's easy for me to, get every last crumb of goodness and then turn around and have somebody wanting to shake my hand. And so hand sanitizer is going to be great. Being careful of where we are when we're taking our masks off is going to be important. And so, Lori, we really love the work that you've been doing. And so thank you again so much for it. I have one last question. And then of course, Tami, if you have any more questions, but I think one of the things that people are curious about in our community are children. And I know we've talked a little bit about Parents' Night Out and having opportunities for that over the summer. We've done a lot of planning for outdoor activities, but we also know that young kids under the age of 12 are not going to have access to the vaccine for quite a while. So, and at the same time, we've had GDK open all year. And so there's kind of this, balancing act of we've been able to have kids on our grounds, but yet we also have not had childcare on Sunday mornings. And so kind of maybe we're asking a question too early of you, but do you have any thoughts about having children on the grounds again, and maybe even on a Sunday morning?
Yeah, we made a lot of our initial guidelines back when children really weren't getting sick and they weren't spreading it much. It was when most kids weren't in school. So our focus when GDK started, the whole first 6 months was keeping the teachers safe, keeping the parents safe on the transfer times. But things changed when kids went back to school. And so different school systems did different things. I have to profess I'm not an expert since I don't have a school age kid, but we know that more kids got sick. We know that they don't get severely sick. However, they are a way for the COVID virus to be spread or to start the variants. So what we've said is, right now, if kids are required in school to wear masks, then kids should wear masks in the well as well. I think what we're going to be doing at our next COVID task force meeting is really digging in on kids and childcare on Sunday mornings to say, what can we do to make that safe and bring that back? So more to come on that in the near future.
That's great. So I actually do have one more question. So there's different reports, there's different speculation in the media about the variants and how that could impact our ability to make the decisions we have about, wearing our masks and how effective are the vaccines. And you shared yesterday that from what you've read and what the studies have shown is that the vaccines have a very high success rate against the different variants, including the one that's right now impacting India. And so our prayers and thoughts are with them, and the different variants that we've seen around the globe and in the United States. So can you maybe just reiterate what you shared there, just in case anyone needs to kind of hear it a second time to feel confident?
Sure. Someone asked in the State of the Well, what are we going to do if like that Indian variant comes over to the US? What will we do? Will we, make changes? Obviously, we need to be prepared to pivot, our favorite word since 2020. But right now, what I've read is, first of all the early variants, like from the UK and Brazil, the Pfizer vaccine, Moderna vaccine, and even Johnson & Johnson did a very good job in covering us, for protecting us for those variants. Just so the Indian one is a little newer, but I just read a study or some evidence last week that said even the Indian variant should be covered well by our current vaccines in the US. So what I said yesterday was, we think that we're protected, but if a surge happens, if all of a sudden the evidence is showing, whether it be from Minnesota or the country, that we need to go back to masks. My point that I made is, everyone at the well did a great job in keeping us safe for the last year. And so we know what works. We know hand sanitizing. We know that masks and distancing work. We know even where we need to distance in the sanctuary. We're all set to go back to that, should we need to. I pray God we don't. But if we do, we're ready, and I think our congregation will take action. I think they'll be prepared for that.
Yeah, we're a little bit more prepared than we were last March.
Oh, no kidding.
Especially when it came to getting our worship out there to everyone. I like how you said pivot was everyone's favorite word. I'm not quite sure that pivot is everyone's favorite word right now. So,
it's definitely the word of the year.
That we need to, retire after a little while, hopefully soon.
Yeah. Yes.
I love it. Well, again, Lori, thank you for all the work you've done, and our thanks is to you as an extension to the entire COVID task force. We really appreciate all the hard work that so many people have done. You guys have really just laid the foundation for us to do the work that we can do. And so thank you for creating a safe space for us to do it. I'm in the office because of the work you guys have done to keep us safe. And so thank you again for all your work. Thanks for the information. We hope that we don't have to talk to you much more about this.
That would be great.
We don't love you, Lori, but
yes.
we'd like to talk to you.
We look forward to interviewing you about other things.
Yes,
so,
there you go. There you go.
So thank you so much. We really appreciate it. And again, if you have any questions, you can always email the well at questions@thewellmn.church, and we'll be sure to help answer anything that we can, start a dialogue, and we are excited for the continued evolution of what life in the midst of a pandemic and post-pandemic will look like. And we're grateful for the team that we have. So again, thank you, Lori. Thanks, Tami, for joining us on Local to Global. If you have any questions, please let us know, but look forward to catching up with you again next week. Thanks.
Great. Thanks, everyone.